Bizarre Medical Legal Cases Part 38. This was a really interesting one. I love both infectious disease and rheumatology cases, so this one was right up my alley. So it was a pretty young lady. She was about 51 years old, and she basically broke out in what's called cellulitis. So cellulitis is basically a very intimate and injurious rash of the epidermis. So it's like the upper layer of your skin. And it was basically growing and growing, and there was no pus, so there couldn't really have they couldn't really perform a culture of the pus. But she eventually went to the ER, where she unfortunately went through septic shock, had cardiac failure, and then died. And upon autopsy, it was found that it was a very simple bug that's living on our skin right now. It's called staph epidermis. And it was actually post-mortem that they found out that she had an undiagnosed autoimmune disease. So basically, she was immunocompromised. And that's why her normal skin flora caused her to the cellulitis, which led to the septic shock, which led to it was a PEA, which is a pulseless electrical activity cardiac arrest, which ultimately led to her death. So extremely rare, extremely bizarre. It was just one of those situations where no one really caught anything because the patient just didn't really show any crazy, crazy symptoms. But yeah, and for more bizarre medical cases, medical legal advice, and medical coaching, subscribe.